All right, everyone. Good morning and afternoon for some of you out there. This is Blake Jones with HealthiestYou, our client success team. Really excited to have you here today. Hopefully you enjoyed some David Bowie to kick off your day here. So we're going to talk about changes, right? Changing behavior, right? And facing the strange sometimes and really kind of making things different, bending the trend, changing behavior, a whole lot of different things that you'll hear today of what we're doing here at HealthiestYou. And so excited to have you join us here today. If you have any questions throughout the presentation, just utilize that questions box. We'll address those when we get towards the end, right before we announce our big Fitbit winner here. So appreciate you joining here today. Hopefully you joined for more than just a Fitbit. You want to learn a little bit more about HealthiestYou and what we're doing here with the ACEC Life Health Trust. So if you've joined us for a webinar before, we do those standing webinars Tuesdays and Thursdays every week. This will be a little bit different, a little bit more informative, sort of our HY 201 level maybe. If you haven't joined us before, I encourage you to join us either Tuesday or Thursday at 10 and 2 Pacific time and learn a little bit more about HealthiestYou, kind of our entry level HY 101, if you will. So we're going to kind of talk a little bit about HealthiestYou high level and then really get into engagement strategies, behavior changes, what we challenge our group administrators to do to really become that HealthiestYou champion. So we're going to jump in here and really talk about that behavior change and what we want to do. So we want to change, right? Change those behaviors. And was really compelled by a podcast and some reading I've done here by Dr. Kyra Bobinet. She's the CEO of Engaged, and what the takeaway was there, what she really indicates is that we shouldn't be so hard on ourselves when we struggle to make positive health changes, right? And in short, it's not us, it's a design flaw. So we want to think like a designer, right? And so for most of you, you're in an engineering and consulting world, and everyone designs everything, right? And so really like the correlation here, and we can design our lives, right? So if we are struggling to make that change within our company, whether it's a personal change or just a company change, trying to get everyone to change those behaviors, right? It's not that we were successful or unsuccessful. It's just a design flaw. Let's change the design a little bit and customize it, right? And so the other thing she says here is that when it comes to health engagement, she's got 5 words of advice, which is be caring, authentic, and useful. And that really hit home here at HealthiestYou because that's what we want to do with every one of our groups and with our members, is to be caring, authentic, and useful and really have a purpose, right? And so that's why we're so excited to talk about HealthiestYou and utilization and engagement strategies and all of those things. And what we really want to do is help develop new habits, right? So I think most of us out there have at least heard of Uber. We've probably used Uber. If you're not familiar with it, I don't know where you've been. Maybe you've been hiding under a rock in the past. But Uber, world's largest taxi company, and they own no vehicles. They've provided an amazing platform to get to where you need, when you need to get there, and really just made it easy, right? I can see where that car is located. They've got a picture of that driver. He's got a picture of me. I can pay through that app very seamlessly. It's so easy, right? And they've really completely shifted that landscape of transportation and changed the behavior, right? I haven't called to get a taxi or a cab in 6 or 7 years now, right? Because I've been using Uber. That's what I'm ingrained to do now. And so what we really want you to do and think about within your company is think of HealthiestYou that way when it comes to healthcare, right? So change that behavior, develop a new habit instead of continually just going to a doctor when we're sick or in urgent care and giving our insurance card and all those extra time and costs that are involved with that, right? Call and talk to one of our HealthiestYou doctors first, right? That should be your immediate new habit, right? And so think HealthiestYou first. So we're going to talk a little bit about that high-level overview of HealthiestYou. Again, if you joined us before, you already know about this. It's a nice refresher course. But for those that might not be familiar, telehealth or telemedicine is one of the biggest features we do here at HealthiestYou. And the idea there and the fact is that over 70 to 80% of all emergency room, urgent care, and doctor's office visits can be safely handled over the phone, right? So we don't need to go waste our time sitting in a doctor's office or urgent care, right? We can call and talk to a doctor 24/7, 365 here at HealthiestYou. And to really give you an idea of telehealth, telemedicine, of where we're headed, right? This is where healthcare, this is the future of healthcare, right? Telehealth's been around for a while. HealthiestYou has been around for quite some time, but healthcare is headed in this direction, and we can't avoid it. And so you're early pioneers with us, which is really exciting. So this report was done by Deloitte last year, and they project just about 300 million e-visits will take place in just a few years. And we were on track for about 800,000 as an industry in 2015. So almost 400% growth there. So we can really see where this trend is going, right? We're seeing healthcare really move in a user-focused way, right? In an easy way. Call and talk to a doctor. No more, no more sitting in a waiting room and waiting on that provider, getting around all those other sick people, right? So again, we want to bend the trend. So let's break that cycle of sitting in a doctor's office or an urgent care after hours or emergency room. We can see all of these costly visit fees that are involved here, and excess amount of germs and all of those things that are involved with going to a doctor, right? Well, let's start with HealthiestYou first. So with HealthiestYou, if you're on that traditional PPO plan, it's completely free through the trust. There's no consult fee, no copay to call and talk to a doctor, right? You're not going to worry about any of those extra germs or travel time to get anywhere. You're not sitting in a doctor's office, right? 24/7, 365. So really just kind of change our mindset and change the way we think things should be done and have always been done, right? Let's change that. Let's bend that trend. So start with HealthiestYou first. These are the top 9 reasons we're currently visiting the emergency room. The same top 9 diagnoses our doctors handle every single day, right? So there's just no reason to go to an emergency room for these common ailments, right? Acute illnesses, right? You can call HealthiestYou for that pink eye, strep throat, sinus infections, you name it, right? There's so many more that our doctors are handling every single day. So again, really start with HealthiestYou first, change that behavior and that trend. So one of the biggest questions we get though is, well, that sounds great, but I want to know who I'm talking to, right? Is it a quack on the other side of the world, Dr. Jekyll, Mr. Hyde? Is it a PA somewhere, a nurse? These are all board certified licensed physicians. They reside here in the United States. They'll be licensed to practice in the state that you're currently in. So you can take a doctor with you while you're on vacation, you're traveling to another state. You'll have that 24/7 physician access from anywhere you're at. Right? Those doctors can diagnose, treat, and prescribe. Again, 24/7, 365, even on holidays. Right? Call and talk to a physician. Right now, you can take us, again, anywhere you're at across the country while you're on vacation, or maybe you're out in the field on business. With the exception of Idaho and Arkansas right now, Arkansas currently has no telehealth capabilities. The state does not allow that, although they are currently reviewing that, and we hope to have Arkansas back on board very soon. Idaho has a limited capability with just a video consult only model. So you can only have a video chat with a doctor, nothing over the phone. But again, we can handle over 70 to 80% of the reasons we go to a doctor. Right, so we're going to take a look here at what some others are saying. These are a couple group administrators from some engineering, some ACEC firms that we've got some really great stories from this week. And I wanted to share those with you to really have an idea of what people like you are experiencing. So Janine Corners here from Zap Engineering out in Lakewood, Colorado. So it was the first time she called, so it took a few minutes to give the information that we needed, which is the medical history and symptoms, et cetera. Once you've provided that the first time, it will be stored on file and you can always update that. So it took a few minutes to get that in, but nothing too cumbersome for her. They told her that she'd get a phone call within an hour from one of the physicians, and that doctor called her back actually within just a few minutes. So she explained her chief complaint or symptoms, and then what her primary care doctor usually prescribes. He agreed with that diagnosis and called in a prescription for her, and she was able to pick that up within an hour of picking up the phone and calling HealthiestYou. So she said it was absolutely wonderful. I didn't have to wait for an appointment with a doctor. Was able to get my medication quickly. She was able to go pick that up on her lunch break. So that was a really cool story, and we love hearing that kind of success story there. Don Cantrud out at Tri-Unity Engineering, also in Denver. So apparently they're putting something in the water in Colorado. that makes everybody sick. But she said, I used HealthiestYou last week when I was sick, really liked that I did not need to go into a doctor's office and sit and wait while I was feeling so cruddy, right? And so that's the thing, right? We don't want to spend time anywhere if we're not feeling well, right? We want to feel better right away, and we don't want to see anybody while we're doing that. So she was able to do that from home and really get the care that she needed. So love these success stories. If you have any or hear any from your employees, please let us know. Would love to feature you here in some of our national webinars. Additionally, maybe in an email spotlight that we send out, our monthly communications we send out. We'd love to feature you in some of those success stories. So we're going to take a look at our smartphone app here real quick and show you some of the ways that we're engaging with our members and with you specifically. So we'll get this to pull up here. There we go. So this is my phone. We're reflecting the HealthiestYou app. If you have not downloaded it yet, stop listening to me. Go ahead and download that app. Search for HealthiestYou. It's all one word, no spaces in there. So HealthiestYou, get that downloaded right away. Once you have that, you'll click on first time here and then simply enter the primary member's last name, date of birth, and zip code, and you'll be on your way. So very simple registration there, just a couple pages there to fill out your login information, and you'll be on your way. And once you're in the app, this is what your experience will look like. This is our kind of quick launch guide here on the front, right? Visit doctor, provider search, price prescriptions. A lot of great features in here to bring you back into the HealthiestYou world and think HealthiestYou first when you need to get that care, right? So let's say I'm sick. The main reason I'm going to use HealthiestYou, I don't feel good. I need to talk to a doctor. So I jump into the app. I hit visit doctor. At this point, my number will come up here. Hopefully your own number comes up on your phone and not my phone number. That would be bad. So I want to call back on my cell phone here. And if I didn't have HealthiestYou, where would I have gone? So I'll just click choose, and then primary care, urgent care, ER. We'll say I was going to go to an urgent care, and then I'll hit request consult here. Once I do that, I'll get a call back about a second or two later that will connect me to the care line representatives and really start that triage process, right? And go through everything that I would need to do there. Think of that as a virtual clipboard that you might fill out at a doctor's office, right? So 2 clicks of a button in here, you're going to start that consultation with that physician. So very, very easy, simple process, right? We use apps for everything. Let's use it for healthcare now too. We'll take a look at our radar feature. Again, different ways to make you think about HealthiestYou and just doing things a little bit differently. So we'll widen this out here. What this is doing is continuously scanning that area around you and showing you the top providers located nearby. So a comprehensive list of those providers, so doctors, urgent cares, ERs, pharmacies, and even veterinarians. We want to take care of those 4-legged family members as well, so you can find those vets nearby. So just another way to bring you back in here. And we've actually found that 44% of our telehealth visits through the app are coming from the provider search. So again, people are looking for a doctor because that's what we're ingrained to do. So they jump in our app, they look for that physician, and then think, oh yeah, I can just call one over the phone. Maybe we can get this taken care of a little more quickly and easily for sure, right? Save some money, save some time there. So just scan the area around you. Maybe you're on vacation and you want to know where the closest urgent care or hospital is at. Now you can jump in here and see, all right, here I am at the red dot, and there's a hospital just 2 miles down the road, just in case anything happens. So again, different ways to engage with you and make you think about HealthiestYou first. If you haven't played around with the app yet, I challenge you after this to download that app, get in there, play around with it, have some fun. A lot of really great features, even more amazing features that our team is developing throughout this year that will get pushed out to the app. So a lot of really, really fun, exciting things happening here with HealthiestYou. All right, we'll jump back over to our presentation here and think about just a few other things that we're doing here with our app and our engagement strategies. So a few ways that we've really set up reminders and those engagement pieces with our members are geofencing. So if you have ever signed up with Starbucks or some retail stores out there, and you've got their app, you'll get some push notifications when you're near those stores. So that's what we've done here with HealthiestYou. Anytime you're near an urgent care center, you get a little gentle reminder and push notification on your phone that says, hey, it looks like you're in urgent care. Don't forget you've got a doctor on your phone 24/7. So call and talk with a HealthiestYou physician now and save yourself that time and money. We've done the same thing here with pharmacies, allowing you to shop for that prescription price through the app first, rather than, again, simply just going to the pharmacy, giving your insurance card and paying whatever they tell you you need to pay. Right? You can shop for that medication through the app and really make sure you're getting the lowest cost medication for that. It'll show you the cash price or the non-insurance price for that medication. Maybe save yourself some money, but save money for the firm as well, right? Important thing to remind yourselves here is that anytime someone's using HealthiestYou, whether it's for a doctor consult or the cash prescription price, that's another claim that's being redirected away from the health plan, right? So the more and more you're redirecting those claims and eliminating those claims, the more and more you're likely to really reduce those premiums. We'll take a look at a success story here of a group that we have who was really able to reduce their annual premium because of that behavior change, right? And so the biggest thing we do here and why we do it is utilization, right? We want to push out HealthiestYou. We want everybody to use it, right? Rather than you get this great new benefit and then you forget about it maybe throughout the year. We want you to use the heck out of it all day, every day throughout the year. So this is why we do what we do. And this is our story, and our big passion is that utilization piece. So look at some of the other companies within the telehealth space here, some of our competitors and friends out there. Their average utilization is about 1 to 5%. Right? If people use it, that's great. It's a nice to have. But with HealthiestYou, it's an absolute must have and must promote. Right, so our company average utilization is 42%, right? So people are using it, they know about it, and they absolutely love it. And that's what we want your firm to really do. And we rely on you as a group administrator to really help push out that notification, those reminders, right? Because we're human, right? We need that help. We need those reminders about things that, are a little different, right? And it takes time. So really help us with that, and we want to really help you push that utilization. So we take a look at this school district I mentioned. It's a large school district in Wisconsin. It's Slinger School District, 225 employees that they had, with 177 HealthiestYou doctor consults. So they had over 86% utilization rate, so double what our average is. Right? So staggering utilization there. It was really exciting. But the best part for them is that they were able to actually reduce their annual premiums. So rather than their 10 to 20% increase that they received the year before, they actually lowered that cost. And they were able to take that money and give it back to their staff and their teachers, and they provided the raises for their staff, which was a really, really great story. We loved hearing that. It brought tears to our eyes here at the office because it was just so cool that we're helping impact those lives, right? And so that's not going to happen with every single company. So don't expect your premiums to go down because you're using HealthiestYou all of the time, although it certainly will, right? And so more and more you're using that, you're going to redirect those claims. So just an example here of what it can do for you, right? So everybody's different and unique. And so, really just push HealthiestYou first, right? And start with HealthiestYou before going to that care center. So, with so many things, again, we talked about being reminded, right, and the engagement piece and all of those different utilization strategies that we do. And a lot of benefits that you might have right now or you have had in the past, you get this really cool card in the mail, and it's got a fun letter. You probably, hopefully, got one of these from us, right, branded HealthiestYou and ACEC Life Health Trust. And hopefully you receive some posters and flyers at the office. And most companies stop right there. But this is really where HealthiestYou starts, right? So we send those out, and then we just kick off a really fun, exciting campaign throughout the whole year, which is our engagement pulse here. So this is really what we do throughout the whole year. That's where life begins, and we start beating, right? Behavior change doesn't happen overnight. And so we really work with our groups, and we want to work with your firm especially to really push out the HealthiestYou communication. And we'll do some digital fulfillment pieces, right? We obviously do these webinars, right? And we'll send out some fun admin marketing emails. And if we've got the email addresses for your employees, then we'll send them some fun monthly emails as well to just help remind them about HealthiestYou. And so we really rely on our group administrators like yourselves to help push out this communication. Really want you to be that HealthiestYou champion for your company and get everyone on board to use HealthiestYou, because it's going to save them time and money and really increase that productivity. So some of the things that we've done here to show you some samples of some of that digital consumer engagement, right? We send out these really fun emails. Hopefully you received one a few weeks ago with the March Allergy Madness season upon us, right? And so we've done a lot of really cool things. We do, some custom fulfillment and custom marketing pieces here. Hopefully, if you did receive this email, hopefully, and what we really want you to do is forward that to your team, right? And so I had quite a few people ask me like, hey, this is really great. What do I do with it now? And that's a great question, very valid question, right? Did you send this to everybody or do I send it off, right? So when you get those fun emails from us, forward those out to the employees, maybe write a short blurb about it and just remind them about HealthiestYou, right? Spring break's upon us. Make sure that you call HealthiestYou if you need, right? Or it's summer vacation, we're off with the kids somewhere, right? Make sure you call HealthiestYou at that first sign of illness anywhere you're at. So again, just that constant communication is really going to help push out that notification and utilization of the HealthiestYou benefit. These are some of those physical pieces that we've done in the past, payroll stuffers, some mailers that we've done. So again, just give you an idea of different things that we really utilize here at HealthiestYou to really drive up that utilization and awareness, right, to save yourself the most time and money possible. Some custom campaigns that we've done here. Again, we're open to a lot of different things, right? If it makes sense for your firm and it makes sense to really push that out, then let's do it, right? And so we see here we've got our secret sauce, really show you the ingredients that go into a successful group with HealthiestYou. So webinars, marketing pieces, payroll stuffers, app registration drives. We're going to introduce a really fun app registration drive and a contest here in the next couple of weeks for all of our ACEC Life Health Trust firms. And we're really excited. So stay tuned for that. We'll get that launched here in just the next few weeks. On that note, if anyone's going to be at the DC conference in April, make sure to stop by the Life Health Trust booth. HealthiestYou will be right next door to it. And we'd love to say hi, and we might be able to fill you in on some of those registration campaigns as well. So again, HealthiestYou, right? We want to do what works for you. So we're not one size fits all, right? What works best for your firm? So before we jump into some questions and announce our Fitbit winner today, I'll leave you here with Jerry McGuire, right? Help me help you. So we love doing fun things around here and really get people motivated, and we want to be disruptive, right? And so that's why you keep getting calls and emails and fun things from us, because we want it to work for you and we want it to really be successful throughout your entire company, really have that domino effect. So if you've got something particular that works for your firm, whether it's a newsletter that you might send out, an intranet where you post everything on there, maybe you would like stickers for hard hats for your employees that might be out in the field, right? Those are different things that we can do to really make sure we have the biggest impact and make it efficient for your firm. So help us help you make your group successful and really have a great partnership here. So think of HealthiestYou as a partner, right? It's not just another vendor or benefit. We really want to work side by side with you to promote the benefit the best to your employees. So we're going to jump into some questions here and announce our Fitbit winner. But first, download the app. So if you haven't done that yet, download the HealthiestYou app, search for HY or HealthiestYou, all is one word, in the Apple App Store or Google Play Store on an Android device. Forward those emails and those important pieces out to your employees and make sure to remind them about HealthiestYou. We all need constant reminding of everything. So share some of these success stories that you've heard today, or maybe some other stories you might have internally, and also share those with us. We love hearing those stories. Again, we would love to feature you and your employees in a national email or webinar and really put you up there and show you as a Healthiest You champion. Right? And most importantly, call Healthiest You first before going to a doctor. And then if you've got any questions, comments, concerns, please email me directly. You can reach me at blake@healthiestyu.com, or you can call me there, and we can make sure to go through all of that with you. So question here. So when we get an email from Healthiest You, should we forward it out to our staff, or are they getting the same email? Great question there. So it will really depend. I would say 9 times out of 10, just you as the group administrator are going to get that email. And it'll usually say, attention admins as part of a ACEC Life Health Trust administrator, yada, 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 right? And so you'll usually be able to tell whether or not everyone's getting that. But most of the time, we don't have those employee email addresses. So if you'd like to provide those, we can create a custom email campaign to send out to your employees. We would love to do that. But more often than not, it's just you as the admin that's going to get that email. And then, ask that you forward that out to the employees, or maybe just attach it with a short little blurb that you can send out to them. All right, wait for a couple more questions if we've got any here, and then we'll announce our wonderful winner here. Again, if you think of anything after this presentation, please email me, blake@healthiestyu.com, or give me a call, and I would be more than happy to help out there. So as we go through here, we'll take a look at our winner. Drum roll, please. Hopefully everybody's creating their own drum roll at their desk. All right, we are going to go with number 9 as I go down my list. Lucky number 9 is Karen Dennis. So Karen, you are the lucky Fitbit winner here today. I will reach out to you after this and make sure to get your address so we can send that out to you. Thank you all so much for joining us here today. Again, any questions, please reach out to me directly. If we want to work with your firm directly on doing a presentation, I'd be happy to do that as well. But thank you again so much. Enjoy the rest of your afternoon, and we look forward to making a successful partnership with your firm.